first talk will be by Dr. Peush Sahani. It's on the ethical issues in the research publication. I've heard him maybe 10 years back about the ethics, and fortunately, I am hearing him again. Thank you very much, sir. Over to you.
A lot of people, but nonetheless, let's see what we can do about this in the short time that we have. So, the ethical issues related to publication are related largely to misconduct of one form or the other. And because this is the most important, I'll talk about these first and then try and cover some of the other issues as well. So, misconduct essentially is behavior or actions not conforming to ethical standards while conducting research and while publishing research. Our focus today is on publishing research, not on the conduct of research. So, the issues that I'll try and cover are serious scientific misconduct, such as fabrication, falsification of data, as well as plagiarism. Redundant publication, you consider a little less serious, duplicate and salami publications. If time permits, conflicts of interest, a little bit about authorship and what are the guidance that we have related to authorship. And finally, a couple of slides on pseudo-journals, just to tell you what they are and make you aware of them and how you can try and avoid them. So does all this occur? I have no intention of trying to go through these lists of serious misconduct. Some of you may be familiar with this. Some of this hit the lay media as well. The 2005 Korea episode, in fact, led to the suicide of a gentleman who was accused of and then proven to have created a false paper, and it was in fact on the cover of Time magazine. Because we're all surgeons, therefore all anesthetists here. No, not because of that. But just to tell you that editors of journals are becoming more proactive. So this revelation of a large number of studies by anesthetists published in anesthesia journals happened because there were 6 editors of anesthesia journals who got together and started looking at papers which they thought were not right up to the mark in their journals and actually found them to be having fraudulent data. I very briefly try and cover something called expressions of concern, something that both the British Medical Journal and the Lancet published in relation to research done in India. And both these essentially were because they were unable to prove a legally provable fraud or misconduct, but said that this is an expression of concern and we are not happy with the work that we have published. Both BMJ and Lancet had published work of this author. So why do people get into this whole business? We used to say publish or perish, but some of the numbers that you had seen as far as the anesthesia journals are concerned would suggest that either it's greed, because you've done your 5, 10, 15, why do you need 150 fraudulent publications, or maybe an addiction of some kind. Let's look at some of the more serious forms of misconduct. Fabrication is making up data or results and recording and reporting these. So you could do this while you're conducting research. It's an experimental lab-based. You make up an image or you manipulate an image. You could do it while writing up research, create non-existent data, and there is evidence of the fact that people have done this. One of the names that you saw on the first slide was of a gentleman called John Darcy. And if you actually do Google's a PubMed search for Darcy J, you'll find 150 retractions. So again, something that tells you that this was not something that was was normal. And all the data that he had there was fabricated data, experiments that hadn't been conducted and data had been just fabricated. Lab books had been fabricated. And his mentor was a very senior person, and therefore he could get away with it for a longish period of time. Falsification is when you manipulate what you have. You alter, conceal, or withhold. So the outliers, I'll take out I'll take out some more of the values so that I get good means and standard deviations. I get better p-values. Remove a few variables because my results then seem more robust. Say I never did studied these parts of the aspect of the disease, and so on and so forth. You could do this partly or completely. You could conceal half the data. Say you studied 300 patients, but 150 were useful to your results, and remove the 150 which were not useful to your results, and so on. People tend to manipulate clinical data, but they also tend to manipulate images. Image manipulation is becoming easier to detect because as it is becoming easier to manipulate images, there's now software available which detects image manipulation. So editorial offices, most of the large editorial offices of big journals have image manipulation detection softwares. Plagiarism is an appropriation of another person's ideas, processes, results, or words without giving appropriate credit. So, if you've published something and I say that you've published this, and I tell you that you've published it and use that information to justify my results, that's perfectly fine. But if I use your results and try to tell the audience that's reading my paper that these are my results, then that's plagiarism. So, words, it's not uncommon. In some countries, it's considered to be serious and people lose their jobs. In India, it's tending to become an issue. More and more journals are highlighting these issues to heads of institutions who are then going ahead and investigating these issues. So there are extremes of plagiarism, from intellectual theft to technical plagiarism. And this is again the anesthesia journal's group of editors which tried to make up this differentiation. But if you look at the last column, what happens to the paper if plagiarism is detected? It's retract the paper in all instances. So the base that's going to happen is retraction of the paper. What are copyright laws? Can I use information which is previously published? So there is fair use permitted. Up to 120 words can be used, especially for educational purposes as a string. But you need to, the key element is transparency. You need to tell people, I've taken this information from so and so. So what we need to do is to try and tell our students, our residents, that if you make up a journal club and you use an image from somewhere, please disclose that this image has been used from somewhere. A lot of us don't point this out in our local journal clubs, and this is something that needs to be done. Can I recycle text? Is there a proportion for recycling text? Well, it's best not to recycle text as far as possible. Can I prevent plagiarism? Plan your paper, take effective notes of material that you've read and wish to use, try and cite appropriately, and learn to paraphrase appropriately as far as possible. You can detect plagiarism by lots of means. There are commercial softwares, there are free softwares. Some of these examples are given you, but there are many more that are available. The redundant publications are both duplicate and salami. The duplicate publications are those where there is a substantial overlap of previously published material. Now, this could be published in a print journal, and you could republish it in an electronic journal. It's still duplicate publication. So a lot of people feel that I've published in a print journal, but I've not published in an electronic journal, so I can go ahead and do this legitimately. You're not. That's not permissible. So why are editors bothered about duplicate publication? It's a waste of resources, waste of peer reviewers' time. It misrepresents information because it tends to suggest to researchers that there is more to something than there actually is, because there's duplication of that same information. But more importantly, with lots of meta-analysis being done, patients are being counted more often than once. And every patient of a particular disease for a meta-analysis should be counted once and not more than once. What is permissible? can I do some kind of publication prior to doing a paper publication? So you publish an abstract because you presented at a conference. The abstract gets published as a supplement in a supplement to a journal or in a regular issue of the journal. That's acceptable. You present at a conference. That's acceptable. It get published in a conference proceedings. That's acceptable. If you do a press report and you release information to the public because you think that information is important, please provide only general information, not actual data. Because if you do, this could possibly be considered, if it's published in the lay media, actual numbers, percentages, p-value get published, then this could be considered prior publication. Duplicate submission is again not permissible. This could lead to, again, a waste of resources as far as peer review is concerned. More importantly, it could inadvertently lead to duplicate publication and sometimes simultaneous publication. So the reason why people submit to 2, 3, 4, 7, 12, 15, somebody said, I always routinely submit to 12 journals because at least one of them will respond in the time frame that I am looking at. And the moment I get an acceptance, I'll withdraw from everybody else. But there could be a position where somebody could say, I'll go ahead and publish, and you could get 2 ahead of print online publications. And that's something that's not acceptable. Salami publications are essentially multiple publications from a single data set. It usually happens with retrospective data sets. Usually happens when you have information which relates to radiology, pathology, clinical information, and the bits and pieces that everybody wants to publish separately. I can tell you a story of something that happened with us, but some other time because we don't have time right now. What about incremental follow-up? Is that acceptable? If the message changes, if the numbers change substantially, yes. But if it's a 3-month increase of follow-up from a 24-month follow-up that you've already got, then an additional 27 months with no change in the message doesn't necessarily mean that this is useful as a separate publication. There's some places where you can justify duplicate publication. I published in a local language journal, and this happens a lot with the Chinese, the Japanese, and the Koreans because they publish in their local language journals, and then they want to publish in an English language journal. Now, if you want to do that, we don't have Hindi language journals. We may have some, or Marathi or Tamil or whatever. But if we have some of these journals ever and we start publishing in them, then we could take the recourse of wanting to publish in an English language journal later or afterwards. But the most important thing here is transparency. Tell the editors of both the journals, this is what you're doing. You've already published in a local language journal, you're now publishing in an international journal. You would also do it when you have a very large study, and the example of that is available where the British Medical Journal and the New England Journal of Medicine both published a paper on glucose tolerance. The American Journal of Cardiology and the NEJM published papers on syncope. They informed the editors, they justified this, and the editors accepted these justifications and actually published these justifications along with the papers. So how do you decide? Is one paper more informative? If you're not sure, submit to the editors and tell them this is what you're doing if you're splitting up the paper, and try and ensure that you have no overlap of data. This is just an extreme. 2 duplicate publications are not enough, so he wanted a triplicate publication, and that too in the New England Journal of Medicine, and finally got caught out. I'm going to stop here and leave out these, except to say that if you ever wish to avoid a pseudo journal or a predatory journal, look at this website called www.thinkchecksubmit.com and go and try and answer the questions there. If you have an answer yes to most of the questions, then that would be a good place to go ahead and publish. If any of your answers is no, then it's a good journal to avoid. Thank you very much.